Alright, so I have my basin, my tissues, my chucks in place. I would have gloves on, and one of the first things that you want to do, you want to assess the nostrils and make sure that there's no polyps or anything in there, and you would choose which nostril that you're going to use. And then you're going to take your anti-reflux valve and put it in the blue tube, blue to blue, and then you want to clamp it so nothing comes out. And then you want to measure to see how far to go down from the tip of the nose to the ear to the xiphoid process. Then you want to mark this with a little piece of tape. And then I'm going to coil the first 3 to 4 inches just so it goes down more smoothly. And then I'm going to put some lubrication on it. And then I'd have her look straight forward, and I would insert the first 3 to 4 inches and stop when she starts gagging or before, and pull it back, give her a break, have her drink some water. And then I'm going to have her swallow, 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 until I reach that piece of tape. And then I'm going to tape it to the brim of her nose, and I'm just going to secure one side until I do my checks. Go around the tube just with one side of the tape. And then for my checks, I am going to get a syringe and insert 5 to 10 cc's of air into the tube. And you want to listen at the fundus of the stomach, right to the left of the xiphoid process, and you want to hear a swoosh, and that's how you know that you'll be in the stomach. And once you hear that, and then you can also pull back a little bit of the stomach fluid. Then you want to clamp it again. And then you would want to test this with some test strips and make sure that the pH is from 0 to 4. And then once you know you're in the stomach, you can come back and secure the other side, the tape. And then you want to hook your tubing up to the suction. And then once you have your tubing hooked up, you want to take off your anti-reflux valve, and you want to grab a clean syringe and insert 5 to 10 cc's of air, just to make sure that the tubing is away from the stomach walls because of the suction. And then once you have that done, you put your valve back on. And then I'm going to take another piece of tape, and I'm going to tape down on the tube. And I'm going to pin it to the gown just so they have a little bit of slack so that they can move their head freely and be comfortable.